Hello and welcome to the special webinar hosted by the American Cleaning Institute titled Back to School Best Practices. I'm Brian Sansoni, ACI Senior Vice President of Communications Outreach and Membership. Today's webinar is part of a joint initiative between ACI and the Centers for Disease Control and Prevention, programs known as Healthy Schools, Healthy People. This initiative is designed to support school systems nationwide with tools to help reinforce hand hygiene and cleaning practices to prevent the spread of infectious disease and reduce related absenteeism. The Healthy Schools website offers resources for teachers, educators, school nurses, administrators, parents, and students. The site also features interactive games for students, quarterly newsletters, educational webinars like this one, and targeted social media messages. For more information, please visit healthyschools.healthypeople.org. We thank you for taking the time to join us today. This webinar will provide us best hygiene practices for the new school year. From hand hygiene to backpack essentials, the webinar covers everything you need to know to start the school year off right. Before I introduce our expert speaker, I want to mention that this webinar is being recorded and it will be available on demand, and all registrants will be notified in the days ahead. So we are very fortunate to have with us today Brittany Robinson, Communications Specialist at CDC's Waterborne Disease Prevention Branch. Since she first joined the branch's Health Promotion and Communications team in 2017, her work is primarily focused on promoting healthy hand hygiene behaviors and other preventative behaviors in schools and community settings. She received an MPH in Health Policy and Promotion from Georgia State University and a Bachelor of Science in Health and Exercise Science from Kennesaw State University. Brittany, we welcome you to today's webinar, and we look forward to your insights on starting off this school year on a healthy note. Brittany, take it away.
Well, hello, everyone. My name is Brittany Robinson. As Brian mentioned, I am a health communication specialist within CDC's Waterborne Disease Prevention Branch here in Atlanta. And I'm here to talk with you all about how to prepare for back to school season and promoting hand hygiene and cleaning and disinfection in schools. All right, so a little bit of background on the partnership work between CDC and ACI. So founded in 1926, ACI is a longstanding nonprofit trade association dedicated to improving health and quality of life through promoting sustainable cleaning products and practices. So in 2001, the Waterborne Disease Prevention Branch initiated a memorandum of understanding with ACI to solidify the sort of working relationship between the two entities. And in 2003, we established the Healthy Schools, Healthy People program. All right, so the Healthy Schools, Healthy People program highlights the importance of hand hygiene and cleaning and disinfection in schools nationwide. Together with making hand hygiene resources available for schools, a large component of the first iteration of this program was an annual awards program. And this program celebrated students nationwide for their innovative achievements in promoting hand hygiene in their school communities. Since then, the focus has sort of shifted into making components of the program and its resources more widely accessible. And so it evolved into what is now an interactive website with tools, information, and educational resources on proper hand hygiene and cleaning practices in school and at home. Oops. All right. So this initiative supports U.S. school systems with resources to reinforce hand hygiene and cleaning practices, to prevent the spread of infectious diseases, and to reduce illness-related absenteeism. The website has general information for all audiences, and it also offers guidance and information for segments that are segmented by audience. And that includes information for administrators, educators, school nurses, parents, and caregivers, as well as students. And there are a couple of screenshots I'm showing here from the website. All right, so part of the back to school activities that CDC has planned for this year include this webinar, as well as newsletters to promote hand hygiene during school season, which we do plan to distribute through our hand washing listserv, which is, you can subscribe to the listserv if you go to our hand washing index page at cdc.gov/handwashing. So also in our plans are promoting the Clean Hands and Spaces training, which I'll talk a little bit more about in the next few slides. We also plan to promote the recently revamped Global Hand Washing Day webpage, which is now available via toolkit format. So this is a sort of a quieter hand hygiene season than we're used to, but we want to extend our gratitude to ACI for always being eager and willing to amplify our work every year. This has really been a valued partnership for the branch, and for the past 20 years or so, we look forward to continuing work together in the future. Right. All right, so on hand hygiene in schools. So this year we have, last year we developed the content on hand hygiene in schools, which we recently updated last month. And it is based on hand hygiene and cleaning and disinfection in schools. And originally it was developed as part of the COVID-19 response, but we made the content a little bit more general to apply for hand hygiene all the time. And the primary intention of this content is to sort of highlight the importance of helping educate youth about good hand washing habits and how it can help protect them from harmful germs and stay healthy as they grow older. All right, so as mentioned earlier, many of our yearly efforts to promote hand hygiene focus on Global Hand Washing Day. Global Hand Washing Day is celebrated every year on October 15, and it is a yearly reminder that hand washing with soap and water is one of the best steps we can take to avoid getting sick and spreading germs together. This year's theme is Clean Hands Are Within Reach. And it calls for coordinated action as we actively work towards universal hand hygiene. And just to note that this observance was founded by the Global Hand Washing Partnership in 2008, and it brings awareness to the importance of clean hands to health and areas all around the world with low access to clean water and hand hygiene resources. And just for a note, for the Global Hand Washing Day webpage that we have on our website, we've revamped that last year. So it now includes a ton of resources for various audiences, including school administrators and educators. So that includes sample newsletters, social media graphics, sample social media messages, links to additional resources, and information about the benefits of hand hygiene in schools and in communities. Okay, so I'd like to talk a little bit about the 5 steps of hand washing. Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout an entire community, from your home and workplace to child care facilities and hospitals. You should follow these 5 steps every time. Step 1 is to wet your hands with clean running water, warm or cold, to turn off the tap and then apply soap. Step 2, lather your hands by rubbing them together with the soap. Lather the backs of your hands between your fingers and underneath your nails. Step 3, scrub your hands for at least 20 seconds. If you need a timer, you can hum the happy birthday song from beginning to end twice. Step 4 is to rinse your hands well under clean running water. And then step 5 is to dry your hands using a clean towel or air dry them. Also, we have this fun when to wash hands animated image or GIF. This is available on our website under the health promotional materials landing page. So here's just a fun description of when to wash your hands in school. Those key times include after using the bathroom, before eating, after coughing, sneezing, or blowing your nose, after touching animals or their cages, after playing outside, and especially when your hands look dirty. And we really recommend hand washing versus using hand sanitizer when your hands look dirty because it does not get the job done as well as hand washing. So, All right, so moving on to cleaning and disinfection in schools. So we have developed this page on how to clean and disinfect early care and education settings. Um, and the environmental hygiene content, which focuses on this information, was published in May. So it includes a lot of information for staff and how they can regularly clean surface to help prevent harmful germs from spreading in classrooms. It also shares a little bit about the difference between cleaning, sanitizing, and disinfecting, which I will go into a little bit more in the slides, the next few slides. Okay, so two of the main ways that we can reduce the risk of surface transmission after a surface is already contaminated are cleaning with cleaning products containing soap or detergent, or using a disinfectant product registered with EPA's List N, which is EPA's list of products determined to be effective against various diseases, and that includes COVID as well. Cleaning is the process of removing dirt and germs from surfaces. Cleaning does not necessarily kill germs, but by removing them, cleaning lowers the number of germs and the risk of spreading infection. Disinfection is the process of killing germs on surfaces using chemicals. Disinfection does not necessarily clean dirty surfaces or remove germs, but by killing germs on a surface after cleaning, it can further lower the risk of spreading infection. Cleaning and disinfection can both reduce the risk of surface transmission. Right. And on wearing personally protective equipment and choosing the right products. So it's important to focus your cleaning or disinfecting if needed on high touch surfaces. That can include doorknobs, it can include staplers or other items in classrooms that are commonly touched. It can also include drinking fountains. So ensuring that cleaning staff are always trained and have the safety supplies they need is always important. And then when disinfecting, using those disinfectants according to the EPA's List N, as I mentioned earlier. Just a note that disinfection products should never be used by children or near children. Right? On sanitizing. So sanitizing is just slightly different from cleaning and disinfecting. Sanitizing sort of reduces the number of germs on surfaces to levels public health codes or regulations consider to be safe. And it is done with weaker bleach solutions or sanitizing sprays. You should always clean surfaces before you sanitize them, and you should always sanitize surfaces that come in contact with children's mouths, such as infant feeding items or toys. Okay, so next I want to talk a little bit about the Clean Hands and Spaces online training that was developed last year. I know our colleague had presented on the pilot version of this during last year's webinar, so I wanted to share a little bit more about the training since it's now live and available. So we initially were working on a 508 compliant version, and now that is available for all, and it is also translated into Spanish. So that's great news for us because translating can take quite a while. So all of the content is provided at a 5th grade reading level, and that is to ensure that all audiences are able to comprehend it. Just to note that it was also funded through the CDC Foundation, so really, really grateful for their support in getting this up and online. All right, so this is just one screenshot from the training. This user is led through the training by Maria, who is a school nurse. And through the interviews, they heard that school nurses were found to be relatable and authoritative enough to lead the training. So once inside the training, the user can choose their role related to educational settings. So they take the appropriate sections within each module for their role. So as I mentioned, pretend I'm a school nurse, and then I would select the K through 12 school nurse option in the upper right-hand corner to see the options. Okay, next I would be taken to the 4 modules. So module 1 covers the importance of hand hygiene and cleaning in education facilities. Module 2 covers proper hand washing and hand sanitizer use. Module 3 is all about cleaning and disinfection. And then module 4 would be about teachers, administrators, others in the school environment who can work with parents and caregivers to help keep children healthy. Okay, and this is just an example of module 2, which is on hand hygiene, and it includes 3 topics. One is for planning for success. Second is cleaning hands with the right materials, and then the third is implementing good hand hygiene. Okay. So this module focuses a lot on great information and guidance on why hand hygiene in the classroom is important to student health, and it promotes quizzes to test provides quizzes to test the user's judgment and knowledge when faced with situations that warrant hand hygiene practice. Okay, and this is just another screenshot kind of showing the differences and how much so maybe not that much soap applied for when you're washing your hands, but it is a really good example of how hand hygiene can help create a culture. And here are 6 strategies as well that you can kind of look through. Each module provides information like this, so it's very helpful based on whoever the audience is. All right, module 3, as I mentioned, is centered on cleaning and disinfecting in classrooms, and this focuses on establishing a formalized cleaning plan, selecting, preparing, and storing the cleaners properly, and then effective cleaning, sanitizing, and disinfecting. Okay, and these are just a couple more screenshots, but I think you probably have a good idea of what you'll be getting when you go through the training. And just one note um, for the training, we've included a lot of our health promotional resources. We really wanted to take full advantage of getting our some of our more popular hand hygiene posters and materials inside the training so that people, including staff and administrators, can know that they're available. So we've made the training available via CDC Train, which is a national leading network that provides quality training opportunities for public health professionals. So to access this training, you have to visit train.org, and you can then search for the course catalog by typing in Clean Hands and Spaces web-based training. Okay, so you may take the training modules at your own pace and at a time that is convenient for you. Completion of all the training modules may take 2 to 3 hours, depending on your educational role. And after completing all of the 4 modules, school and early care and education professionals can receive free continuing education credits. This offering was an important factor for us to be able to reach and incentivize educators across the country, as we know they are required annually to complete a certain number of hours. Okay, and the last couple of slides, I want to discuss what we have planned this year. So earlier, I did mention some of our back to school activities. And this year, though we're conceptualizing a few resources for middle school aged kids, we are primarily focusing on repurposing priority content and materials as relevant rather than creating another suite of new materials. With that, we aim to promote the 2 web pages I discussed earlier, so the hand hygiene at school web page, as well as the how to clean and disinfect early care and education settings. We also want to promote the Global Hand Washing Day Toolkit and the new theme. We also want to get those new posters that we have on key times for hand washing and some of the other, we have animated images and still images for that key times to wash hands at school poster. And then we also have social media graphics and a social media library with messages on hand hygiene that can be shared throughout the year. And lastly, we also have printable stickers encouraging hand hygiene. We also have many more materials that are available on our health promotional materials landing page. So feel free to visit that page if you want to look for resources or materials for visual cues and help encourage hand washing in your school communities. Okay, so that is all I have. Thank you all for tuning in, and feel free to reach out if you have questions. Thank you.
Brittany, thank you so much for sharing information about the best hygiene practices for the new school year. Before we wrap up today, I'd like to share a resource that can help ensure you are cleaning your school environment with confidence. The U.S. Environmental Protection Agency certifies cleaning and disinfecting products made with ingredients that are safer for people and the planet without sacrificing performance. Look for the safer choice and design for the environment logos for participating products that meet EPA's stringent criteria. To learn more, visit epa.gov/saferchoice. As a reminder, this webinar will be made available for on-demand viewing and will be emailed to all registrants. And we invite you to share it with your colleagues and communities. We also encourage you to visit the Healthy Schools, Healthy People website for year-round resources on keeping our school communities clean, healthy, and safe. Please visit healthyschoolshealthypeople.org. And as a final reminder, the American Cleaning Institute provides science-based information on cleaning and hygiene, fabric care, and disinfecting practices for multiple audiences, which you can find, again, year-round on our website at cleaninginstitute.org. I'm Brian Sansoni. On behalf of ACI and our member companies, thank you, and stay safe and stay healthy.